Hey there, future healthcare enthusiasts. Welcome to the second of my series on alternatives to medical school. Before I get into the video, please make sure to like, share, comment, and subscribe. Thank you. Hello, my name is Emanuela and welcome to the Professional Corner. In the first video, I talked about doctoral alternatives to medical school. In these professions, you are a doctor, but are in more specialized disciplines that don't require you going to a medical school. They do require as much hard work as medical school. But if these do not appeal to you, there are still plenty of exciting options. With the peripheral medical positions, you work in an assistive role and their earning potential does not diminish also. So basically, you still make money. As usual, we will be looking at a brief description of the profession, entrance exams, training, so how many years is required before you start in this program, and the average salary. First on the list is registered nurse RN. So registered nurses are healthcare professionals that are responsible for providing and coordinating patient care. They administer medications, monitor patient vitals, collaborate with other healthcare professionals, and provide emotional support to patients and their families. The training for this is 4 years of your bachelor's, where you graduate with a BSN, Bachelor of Science in Nursing, and then you pass the NCLEX RN, which is the National Council Licensure Examination, to get your license. You can also get your nursing degree as an associate. The average salary for a registered nurse is about $89,000. As an RN, you can advance to become a nurse practitioner, which I mentioned in part 1 of this series, or you can become what is known as a CRNA, which is a nurse anesthetist. Nurse anesthetist. Okay. Okay, up next is nurse anesthetist, which we call a CRNA, so a certified registered nurse anesthetist. I'm just gonna stick to CRNA. A CRNA is a highly skilled healthcare professional that administers anesthesia to patients undergoing medical procedures. So basically, if you're getting surgery or if you're getting any medical procedure that requires anesthesia, CRNAs are the ones that administer those. They work closely with physicians, surgeons, and other healthcare professionals to make sure that patients get the level of anesthesia that they need, and they are closely monitored throughout the procedure. To become a CRNA, you need to have completed your nursing degree, you need to have medical experience, so spend some years working even after you become a nurse. You also need to find a CRNA program. And after that, you pass the National Certification Examination to get certified, and boom, you're a CRNA. The average salary for this from the US Bureau of Labor Statistics, as usual, is about $206,000. That's mind-blowing. Next is midwifery. Midwives provide care to women during pregnancy, childbirth, and the postpartum period. They manage the overall health of the mother and the baby. They provide education and support to the mother, and they monitor the progress of labor. Midwives work in hospitals, birthing centers. They also provide care in the home if you want. They work closely with obstetricians. I can't seem to pronounce these words. They work closely with obstetricians and other healthcare professionals to ensure a safe and healthy delivery. There are two paths to becoming a midwife. One, you can either complete your nursing degree, so you get your RN, and then complete the nurse midwifery program. That's about 2 to 3 years. Or if you already have another healthcare degree, such as a physician assistant, you can choose to pursue a graduate program in midwifery. The average salary for that is $122,000. Up next is the healthcare career that I mentioned while talking about midwives, and that is physician assistants, or PA. Physician assistants, or PAs, are healthcare professionals that work under the supervision of a licensed physician to provide medical care to patients. They take medical histories, conduct physical exams, they order and interpret diagnostic tests, and they can prescribe medications in the US. So basically, PAs are pretty much what their names mean, because they do similar things to what the physician does, only they have to be supervised. The training for a PA is you go get your bachelor's for 4 years, and then you do the PA program, which is 3 years or 27 months, and then you take the Physician Assistant National Certifying Examination PANCE. Once you do that, you can become a PA. Most PA schools, however, require medical experience before getting into them. So after getting your 4-year degree, you can choose to be a CNA an EMT, or a doula. Doulas work similar to midwives. So you can choose to do either of those three to get your medical experience and then go to PA school. The average salary is $125,000. So still six figures. Next on the list is the speech language pathologist, which I would call SLP because speech language pathology is too long a word to pronounce. So basically, speech language pathologist, SLP. So SLPs work with individuals who have difficulty communicating or swallowing. They assess and diagnose speech, language, and swallowing disorder and develop treatment plans to address these issues. SLPs may work with individuals of all ages in various settings. So they work in schools, hospitals, private practices. They may also work with individuals who have cognitive or neurological disorders that affect your communication or swallowing ability. The training for an SLP is you get a bachelor's degree with courses that relate to speech language pathology. Then you get your master's in speech pathology and you complete a clinical fellowship in speech pathology, take the praxis examination, and you get your license. The average salary for that is $89,000. And last on the list is respiratory therapist. Respiratory therapists treat patients with breathing and cardiopulmonary disorders like patients with asthma, premature infants with underdeveloped lungs, elderly individuals with COPD. They conduct tests, make treatment plans, administer therapies, and they manage equipment and also educate patients. They are primarily found in hospitals, but they can work in various healthcare settings. The training for this is the bachelor's degree or associate's degree, and you become certified by taking the NBRC, which is the National Board for Respiratory Care, to become a certified respiratory therapist or registered respiratory therapist. The average salary for a respiratory therapist is $74,000. So in summary, some of the alternatives to medical school that I call peripheral medical positions are registered nurse, CRNA, midwife or midwifery, physician assistant, speech language pathologist, and respiratory therapist. Like I said in the first video, these professions are not lower than an MD or a DO, and they don't make you a failure. They are also quite important. If we had hospitals with just medical doctors and no registered nurses, no speech language pathologists, no midwives, then we would be in serious trouble. So make sure to hit that subscribe button so you don't miss out on any of our upcoming episodes. If you have any questions, comments, or if you've got a specific alternative you'd like me to explore, please feel free to drop them in the comment section below. And until next time, keep pursuing your passion, and I'll catch you in the next video. Bye!